Good afternoon. My name is Dana Cornelius, and I'm certified in plant-based nutrition through Cornell. Dr. Colin Powell, a food scientist, had crafted an incredible program that was designed for both CEU credits for professionals, paramedics, doctors, nurses, and the like, and also layperson. So I didn't have to take the 10-page exam at the end of it. I did have to write a paper. In any case, it changed my life. So I got into nutrition simply because I was afraid that the health care costs would go up as my age went up. So I needed to take my health into my own control. I took it back. So I delved deep into my studies. Here I am, midlife. I haven't gotten sick in over 20 years, not even the sniffles. I am not on any prescription medication, and I sleep like a baby. So shortly after I got certified, I started counseling in nutrition. One of my first clients was a nurse. She nursed my father in the hospital. So I helped her, and that was amazing. And I also learned the value of being of service. It is a life-changing experience all its own. My dad had AD, and I used everything I learned and applied in my own life to him, and then some. So I studied the AD brain in the relationship between food and disease. I was able to not only ameliorate my father's Alzheimer's symptoms, I was not only able to suspend its development, but I also was working on reversing the disease. It was amazing. His caregivers couldn't believe it. One of his caregivers came up to me and she whispered, she says, "Your father, he's so strong and he doesn't eat meat." And I whispered back, I said, "He's strong because he doesn't eat meat." So anyway, that's my secret. I'm vegan. I also want to add this. Both my parents suffered from obesity. At one time, they were both morbidly obese in their 60s. And I look back at the pictures and how I normalized that. Now, I've never been obese myself. My brother now suffers from it. But I'm one of those mesomorphs. I can certainly get obese if I let myself. So I actually work at my physique. I am of normal weight and disease-free because of my diet and lifestyle choices that I had to actually learn, okay, in my adulthood. And lastly, I did spend a considerable time in behavioral health, not in the area of obesity, but sometimes we would get clients that had a body dysmorphia. That is someone that could be anorexic or of total normal physique, but when they look in the picture, they see a completely different person. It got pretty extreme to the point where we had to actually cover all the mirrors because it was so disturbing to that pathology, that the client that was experiencing that pathology. So that's a little bit about me. I love this area of life. I feel I have so much to give and so much to offer because of my personal experience and the success that I had with my dad. Unfortunately, he did pass away, not from Alzheimer's, but from something completely different. And that was 5 years ago, pre-COVID. And I was actually on my way of writing a book about the relationship between food and disease and how it can treat Alzheimer's. I was set to go, but he did pass away, and I spent most of that time, the next 24 months, decompressing because I was his 24/7 caregiver. And during that time, unfortunately, someone beat me to it. There were a lot of books that I found in the alternative medicine community that did address just that. So anyway, that's okay. I'm glad the information is out there. I just hope that everyone gets to read it because food is truly the medicine of choice.